Welcome to our channel, where we're tackling a crucial topic that affects millions worldwide: breast cancer awareness and early detection. Today, we're diving deep into the signs and symptoms you should never ignore, empowering you with knowledge that could save your life or the life of someone you love. Breast cancer is a formidable opponent, affecting approximately 1 in 8 women in their lifetime. It occurs when cells in breast tissue grow uncontrollably, forming tumors that can be invasive or non-invasive. While it predominantly affects women, men aren't immune. About 1 in 833 men will face a breast cancer diagnosis in their lifetime. Non-invasive tumors, also known as in situ tumors, are characterized by the following. They remain confined to their site of origin. They do not spread beyond the layer of cells where they initially developed. They do not invade surrounding tissues or organs. They are typically easier to treat and have a better prognosis. In breast cancer, a common example of a non-invasive tumor is ductal carcinoma in situ, DCIS, where abnormal cells are found in the lining of a breast duct, but have not spread outside the duct. Invasive tumors, on the other hand, have distinct characteristics. They grow beyond their original location. They can penetrate surrounding tissues and organs. They have the potential to spread to other parts of the body through the bloodstream or lymphatic system. They are generally more serious and may require more aggressive treatment. In breast cancer, invasive ductal carcinoma, IDC, is an example of an invasive tumor. It starts in a milk duct but has broken through the duct wall and invaded the surrounding breast tissue. The two most common types are 1. Invasive ductal carcinoma, IDC, starts in the milk ducts and spreads to surrounding breast tissue. 2. Invasive lobular carcinoma, ILC, begins in the milk-producing glands, lobules, and invades nearby tissue. Several factors can increase your risk of developing breast cancer. Age, risk increases as you get older. Family history of breast or ovarian cancer. Genetic mutations like BRCA1 and BRCA2. Early menstruation before age 12 or late menopause after 55. Dense breast tissue. Lifestyle choices, alcohol consumption, obesity, lack of physical activity, hormone replacement therapy, previous chest radiation therapy. Interestingly, while white women are more likely to develop breast cancer, African American women tend to have a higher mortality rate. This disparity highlights the importance of awareness and early detection across all demographics. Let's talk about the red flags your body might be waving. Feeling a lump in your breast can be terrifying, but remember, not all lumps are cancerous. However, any new or unusual mass deserves attention from a healthcare professional. Cancerous lumps are often hard, painless, and have irregular edges. Your mirror can be a powerful tool in early detection. Look for changes in breast size or shape, skin dimpling or puckering, like an orange peel texture, redness, scaliness, or thickening of the nipple or breast skin, nipple inversion or retraction, swelling of all or part of a breast. While some discharge can be normal, especially during pregnancy or breastfeeding, any bloody or clear fluid coming from the nipple outside of these periods should be evaluated by a doctor. Although most breast cancers are painless in the early stages, some may cause a persistent dull ache in the breast, tenderness or pain in the armpit area, breast or nipple pain that doesn't subside. For women with dense breast tissue, detection can be more challenging. Dense breasts have less fatty tissue and more fibrous and glandular tissue, which can mask potential tumors on mammograms. Additional screening methods may be necessary, such as ultrasound or MRI. Self-exams are crucial, as you might detect changes that mammograms miss. Discuss your breast density with your healthcare provider to develop a personalized screening plan. Women with dense breasts have a slightly higher risk of developing breast cancer. This is partly because dense tissue can make it harder to spot abnormalities on mammograms, potentially delaying diagnosis. Performing regular self-exams is crucial. Here's a comprehensive guide. 1. Visual inspection. Stand in front of a mirror with arms at your sides. Look for any changes in breast size, shape, or symmetry. Check for skin changes, including dimpling, puckering, or redness. Raise your arms above your head and look for the same changes. 2. Physical examination. Lie down and use the pads of your fingers to examine each breast. Use a circular motion, covering the entire breast from the collarbone to the abdomen and from the armpit to the cleavage. Vary the pressure to feel different depths of tissue. Check for any lumps, thickening, or changes in texture. Gently squeeze each nipple to check for discharge. 3. Standing examination. Repeat the physical examination while standing or sitting. Some women find it easier to do this part of the exam in the shower when the skin is wet and slippery. Aim to do this once a month, a few days after your period ends when breasts are less likely to be swollen or tender. For postmenopausal women, choose a consistent day each month. Don't wait for symptoms to escalate. Seek medical advice if you notice any unusual changes in your breasts, you have a family history of breast cancer, you're due for your regular screening, you experience persistent breast pain or discomfort, you observe any skin changes on your breasts, you feel a lump or thickening in your breast or armpit. Remember, early detection can significantly improve outcomes. Be proactive about your health. Regular screening is crucial for early detection. Here are the primary tools used. Mammograms are low-dose X-rays of the breast. They can detect tumors before they're large enough to feel and can also identify microcalcifications that may indicate early cancer. Women aged 40-44 should have the choice to start annual screening. Women 45-54 should get mammograms every year. Women 55 and older can switch to every other year or continue yearly screening. Ultrasound uses sound waves to create images of the breast tissue. It's often used as a follow-up to mammograms, especially for women with dense breast tissue. Magnetic resonance. Imaging, MRI, uses magnetic fields to create detailed images of the breast. It's typically used for women at high risk or to further investigate abnormalities found on mammograms or ultrasounds. A healthcare provider manually checks for lumps or other changes in your breasts and underarm areas. This is typically done during your annual physical. While some risk factors are beyond our control, there are steps you can take to reduce your risk. 1. Maintain a healthy weight. 2. Exercise regularly. Aim for at least 150 minutes of moderate activity per week. 3. Limit alcohol consumption. 4. Avoid or quit smoking. 5. Eat a balanced diet rich in fruits, vegetables, and whole grains. 6. Consider breastfeeding if possible. It's associated with a lower breast cancer risk. 7. Limit hormone therapy after menopause. For women with a strong family history of breast cancer, genetic testing may be recommended. This can identify mutations in genes like BRCA1 and BRCA2, which significantly increase breast cancer risk. If you're considering genetic testing, consult with a genetic counselor who can help you understand the implications of the results. A breast cancer diagnosis can be overwhelming. Remember, you're not alone. Many organizations offer support, information, and resources. American Cancer Society provides comprehensive information and support services. Susan G. Komen offers education, research funding, and support programs. Breastcancer.org provides up-to-date information and an active online community. Understanding breast cancer and its signs is your superpower in the fight against this disease. By staying informed and vigilant, you're taking charge of your health and potentially saving your own life. We encourage you to share this information with the women in your life. Together, we can create a community that prioritizes breast health and supports each other in this crucial fight. Thank you for joining us today as we explored the latest developments in cancer research and treatment. Remember, knowledge is power. Stay informed, stay hopeful, and don't hesitate to share this video with someone who might benefit. If you enjoyed this video, subscribe to our channel, hit the notification bell and like button, and watch our other videos. This will help us tremendously to grow the channel and continue to provide meaningful content. Together, we can make a difference.